Today, we're going to be talking about an upper lid blepharoplasty. A blepharoplasty is...
That's a big word for you.
Yeah, I know. It's a fancy name for an eyelid job. Some people talk about when we're doing facial rejuvenation or, hey, I need my eyes done. We're talking about a blepharoplasty or an upper lid blepharoplasty, and that's what we're going to talk about today. That's in contrast to a lower lid blepharoplasty.
You said a lot there. There's really two good reasons to do an upper lid blepharoplasty. One would be for cosmetic reasons. If you've got extra skin that you just don't like the appearance of, you feel your eyes look tired. Other reason would be for a medical indication. Medical indication would be if you're having visual field obstruction because your eyelids are covering your upper visual fields.
I frequently worry about your visual fields myself, that you're not really seeing things the way I see them, which is the correct way. Nevertheless, we are going to have a guest today that we're going to talk to. Dr. Adlington is going to come in. He's going to talk about how one might be evaluated for visual field obstruction, and that might potentially lead to a medical reason to do an upper blepharoplasty.
Sure. We're also later in the show going to show an example of an upper lid blepharoplasty that's done for cosmetic reasons, in addition to some of the other stuff that goes along with that.
Yeah, I think it's a surgery that's pretty easy for the most part. I think most patients recover from that surgery very, very quickly. It's a relatively easy operation, I think, for most patients. It can certainly be combined with other facial rejuvenation, such as a facelift or a lower lid blepharoplasty, or numerous other things. But today we're really just going to focus on the upper lids.
Sure. The really neat thing today too, in addition to seeing some surgery that we do, you're going to see before and after pictures and get to interact sort of with the patient to see what they go through and hear from their own experience in their own eyes.
So this is my favorite part of the show, where we have the introduction. I say, Dr. Wrye, so glad you're here. I know this is your favorite part of the show as well.
I have other favorite parts, but this is one of my favorites.
At any rate, so we'll look forward to seeing Dr. Adlington. We're going to talk about blepharoplasty, and welcome to the show. Hey, so we wanted to welcome Dr. Travis Adlington from the Adlington Eye Center. We literally got you just off the ranch.
Welcome and thank you.
Thanks for coming in.
Yeehaw.
Yeehaw.
Good to be here.
What's up with the arm?
Well, 20 years of abuse, and I finally had to pay the piper, so, but it came out very well.
Sure, well, good.
It's healing well.
We didn't do that to you. The shoulder thing.
Are you sure?
Hey, tell us a little bit about Adlington Eye Center.
Okay, you bet. Thank you. Well, we're a full-service eye care center on West Plum Lane in the Plumgate Center. And our niche, our specialty is high-end, very unique. Let me back out the high-end. It doesn't mean expensive, but very unique, very funky, one-of-a-kind eyewear.
How do you find this eyewear?
Very small artist lofts around the world. Denmark, Italy, Germany, Indonesia. Even right here in the United States, we found a couple of small lofts that produce some really cool stuff.
Travel around, check out these artists,
we do.
and
we do.
hand select the eyewear.
We do, and we hear about it from colleagues and other people in the industry.
Very neat.
Yeah,
cool.
It's a lot of fun.
Awesome.
Yeah.
So this is for anybody who wears glasses, right? I mean, young people, middle-aged folks like Dr. Wrye.
And old people like all.
And old people like myself.
Amen. You betcha. Anybody and everybody. Our our client base is, there really is no client base. It goes everywhere from teens to 90 years old.
Sure.
And yeah,
Sure.
we love them all.
Sure. Well, you talked about this being a full service practice that you have, and we're of course talking about blepharoplasty in patients that have visual field obstruction because their brows are hanging down, their eyelids are heavy with skin, and it obstructs their vision. Can you tell me how you evaluate people with that process, for that whole process?
Sure. It's very fast, very painless. What we do is what's called the visual field exam, which basically tells us how the patient is seeing to the sides, down, and especially up if you have a lid problem. So we'll do one with just the lids the way they are, and then we'll tape them up with a surgical tape that doesn't hurt when you pull it off. The whole thing takes 10 minutes.
Sure, you said something funny earlier. You know, someone that walks around like this, right? Because they can't see, right? That's a classic patient that needs to be evaluated for this.
Doesn't that drive you crazy? It's like seeing people with their glasses like this. I just want to go up and...
Oh, I'm sorry. Do I need to fix my glasses
no,
for you?
No, you're good. But I mean, it drives
Let's get
me
this guy
crazy.
out of here. I'm done with him.
Same when I see people walking around like this. It's just such a simple process.
Sure.
Yeah.
Sure.
So, and especially when it's done well. And I heard great things about you guys' practice and
Sure.
the great results that you get.
Well, and another thing you were talking about, you've seen some other groups where maybe they were overcorrected and they look shocked with their eyebrows being up way too high. I mean, we see that from time to time too. Dr. Hall lives his life that way, but that's not a natural look. We don't aspire
I'm
to
still
achieve
trying
that.
to figure it all out. My eyes are just total surprise all the time.
The Marty Feldman syndrome, right? Yeah.
Well, that's obviously something that we want to try to avoid when we're doing this,
Right.
right? I mean, the
You
idea
bet.
is for a medically indicated blepharoplasty, the idea is to improve that visual field.
Absolutely. Absolutely. And when it comes out well, it's art, I think. I love to see a good blepharoplasty. It's just what a difference in someone's
Sure.
appearance.
Kind of like some of your high-end eyewear.
Yeah, it changes
little bit of
how
art
people
that
look.
you're getting
you
from
bet.
everywhere.
You bet. You bet. You bet. We've always said every face is a work of art, and every work of art deserves a perfect frame.
Wonderful. Well, thank you very much for coming in today, spending a little time. We've enjoyed it.
It's been an honor.
Thank you.
Thank you.
Reno is like no place in the world for gardening. The staff at Garden Shop Nursery knows that. Ed Bath, the owner, knows how to order plants that are suited to this environment. That's what I'm looking for. The fact that I don't have to replant for a customer. The fact that I've brought satisfaction and beauty at an affordable price. I use the Garden Shop Nursery because I can't afford failure. And when I use Garden Shop's products, I get happy customers and beautiful gardens.
Hey, so welcome back. We're gonna break and go to the second feature now, which is the part where we're gonna talk to a patient, as we might normally do, on a consultation about going to have an upper lid blepharoplasty.
Consultation is going to happen weeks, months, days before the actual surgery. Consultations where we have the opportunity to interview the patient, examine the patient, determine the appropriate operation for the patient, and then talk about surgery.
Hey, so we're going in to talk to Jen. She's here to talk about an upper lid blepharoplasty. So we're going to talk, see if she's a good candidate. Hey, so we're talking about what is concerning to you. Tell me, what's bugging you?
So I'm just noticing a lot of extra heavy skin on my eyelids, and I've always had one eye smaller than the other. And as the skin gets heavier, that eye just keeps getting droopier and droopier. So I've heard this is a pretty simple procedure. I'd like to look into seeing if it would work for me.
It's not simple. It's one of the most difficult things that we do.
Really?
No, I'm just kidding. Obviously, hey, do me a favor. Come sit over here, and we're just going to take a look. Because one of the things that we have to determine is if this is indeed the thing that's going to reach your goals.
Okay.
And we had talked a little bit about, you said, I felt one eye was a little different than the other eye. And yeah, I'm seeing that.
And as I get older, it gets more and more.
You're
different.
noticing it more and more.
Mm-hmm.
Most people probably don't even notice that, but you notice it. And yeah, on your right side, it's down a little bit more. And when I say down, the skin of your upper eyelid, one of the things that we worry about is, are the eyelids themselves in the right position?
Oh.
This is a different operation than just doing an upper lid bleph or removing the skin. Essentially, there's also some muscle tightening that might need to be done. In such a case, I don't think that's a concern for you. But I am going to just feel your face if I might.
Sure.
I'm just going to be touching here. The other thing we want to do,
You want my eyes open?
I want you to look just straight at me.
You know, I considered this surgery because I've always had one eye smaller than the other my whole life. And as I get older, my smaller eye, as the skin gets heavier and heavier on top of it, my smaller eye is really starting to droop. And people are telling me I look tired. They're asking me how I do all the things that I do in a day, which means that they really think I look tired. And so I just thought it was time to kind of freshen up my eyes.
One of the things that we might consider in some patients is a brow lift. And I'm going to tell you, I don't think it's so much of a necessity in you, but you're going to just feel my hand here. I'm going to have you close your eyes, and I'm looking at, and now I'm going to have you open. Yeah, and I think that, as you had noticed, the right eyelid's a little bit different, but you do have a little bit of what we call dermatochalasis. Fancy name means too much skin, extra skin on the eyelids, both of them, but a little bit more on the right than on the left, yeah. And when we do this, what we would do is we would take a little bit of skin from each of the eyelids, and the idea is we want to try to make things as symmetrical as possible, realizing that nobody's 100% symmetrical.
Right.
And you've noticed this since every time when you were real little.
Absolutely. And I don't know that I want to be perfectly symmetrical.
Good,
That might be boring.
nobody can make you perfectly symmetrical, but we want to try to give you as much symmetry as possible when we're doing any kind of an operation, and this is no different. But what we would do is we would take the extra skin and some of the muscle that's out of the upper eyelid like this.
You actually take muscle too, huh?
We take a little bit of the muscle that's underneath there. There is a little bit of a fat pad that people will have. Actually, there's two fat pads in the upper eyelids, here and here. And in some cases, it's more pronounced than others. In your case, you don't have a tremendous amount of extra fat.
Good.
Yes, it's a good thing too.
One thing women don't want is fat.
Fat in the right places is a beneficial thing.
I'm not really nervous, to be honest with you. I know this is a pretty simple procedure. I feel comfortable with the doctors. The staff here is great. I'm really not nervous. I've been told there's no pain, so I guess the only thing I'd be nervous about is if there is, but that's okay too.
Pretty simple. You know, I always like to say minor surgery is surgery on somebody else. When it's on you, it's a big deal, right? But in terms of pain and recovery, this is something that we generally say is pretty darn easy to go through, relatively well tolerated, and I think that you would do a fine job going through this. I think you're a good candidate for this.
How long will the surgery take?
Well, I did it once before, so we'll set up time, be done in less than an hour.
Okay.
Okay?
You did it only once before?
Yeah, but I stayed at a Holiday Inn last night, so
okay.
we're all good.
We're safe. So I'm really hoping that I'm just going to look refreshed, maybe a little more perkier, a little happier, maybe a little younger, won't be so bad either. I don't know. I guess I'm just looking for kind of something to make me feel excited and just a little bit more alive.
So when we're looking at a patient preoperatively and we're planning what we want to do, we want to have a good plan. The idea isn't just make stuff up as we go along. And so when we're marking a patient, and this could be for any surgery, this is giving us a guideline of where we want to operate, what tissues we want to remove, what tissues we want to leave behind. So the markings can be done in a number of different ways. Every surgeon may have a different way of doing their markings, but the markings that are done give a very good outline of what we're planning to do. Certainly, as a patient moves from a sitting to a standing position to a position where they're supine or lying down, things can change. This doesn't necessarily occur just with the eyelids, but may occur on any area of the body. So what we want to do is we want to make sure our marks conform to what we're trying to achieve in different positions where the patient may be sitting, lying down, so on and so forth. So with an upper eyelid blepharoplasty, this is a surgery that we'll frequently do with the patient asleep. The patient will be totally out. However, in some cases, it can be done safely and effectively with the patient awake. So this is usually a preference for the patient. If we are going to have the patient awake, we're doing this under a local anesthesia where we're injecting numbing medicine into the area where we're going to operate. The numbing medicine itself is infiltrated with a needle and a syringe, and it's a little bit painful when it goes in. Certainly there are ways that we have of trying to make it less painful. And there are different kinds of local anesthesia. Some last longer, some are shorter acting.
I mean, I can tell where you are, but
Yeah.
it doesn't hurt.
Well,
So I don't know if I'm supposed to be able to tell.
you know, I can make it hurt more if you want it to.
I'm just letting you know what I feel.
You're
and what I don't.
awesome. I'm just kidding you, right? You're still getting numbing medicine.
Why do I think you're lying to me?
I wouldn't lie to you.
Okay.
Not here, I wouldn't.
Not on camera.
Well-
Get busted.
Yeah, that too. Now you're getting numbing medicine, and we're not going to do anything until we are sure.
It feels like you're cutting.
I'm not.
Well, I can. Whatever you're doing right now, I feel it.
Is it hurting?
I can feel.
You can feel
that
something.
you're poking me.
Yes, I am. I'm poking you with a 30 gauge needle, very small needle, and I'm giving you some numbing medicine. And the idea is to get you numb before we do anything that's going to hurt. So when we're starting the procedure and we've already infiltrated the patient with the local anesthesia, then we're excising the tissues that we don't want to have there. We've already marked those, so we have a good outline of where we're wanting to cut, and a scalpel is used to incise the skin. With this particular operation, we're actually removing skin and a little bit of the muscle that's underneath. That muscle is then taken off with the skin, usually with some scissors and forceps. There are certainly patients that may have more skin, may have more muscle, and then there are patients who have fat that needs to be removed as well. This is something that must be addressed in each individual patient. In this case, we didn't have a whole lot of fat that needed to be addressed, but certainly there are patients where there's more extensive removal of more tissues. You'll feel a lot of pulling. This is not something that you say, oh my
That's
God.
weird. Feeling.
Yeah, it's not comfortable. I'm not telling you, oh, this is something everybody wants to do every day. I got a
It doesn't
treatment
really
at the
hurt.
spa.
But I know I could tell you're ripping off my skin, which is kind of
Well,
gross.
we prefer to say gently excising rather than ripping. When we're dealing with closing the wound, there are a number of different ways that that can be done. The most common way that we do this is with sutures. There are a number of different kinds of sutures that can be used. There are dissolving sutures. There are sutures that need to be removed later. There are black sutures. There are blue sutures. A lot of times this may be a preference of the surgeon or in consultation with the patient deciding what suits the patient best. In this particular case, we talked about, well, there are different options that we might use, but because of lifestyle choices and immediate post-operative activities that might need to be considered, we elected to use some dissolving stitches. These are very, very fine sutures that really are dissolving within the next week or so. With any patient, there are differences from one side of the body to the other. No patient has exact symmetry in any part of the body, whether it's their eyes, their mouth, their nose, their breasts, their abdomen, their legs. In this particular case, there was actually a noted asymmetry of the right eye to the left eye. And so what we want to do is we want to try to give as much symmetry as possible. We realize that we're never going to make anything 100% exactly symmetrical. But the idea is try to make things as symmetrical as possible. So we did have a noted excess on the right side in this case, so we plan to take a little bit more skin on the right side than we did on the left side. So for an upper lid blepharoplasty, we generally want to tell patients that there's going to be some bruising afterwards, and every patient's different. I can never predict how much a patient is going to bruise. Some patients have very minimal bruising. Some patients have more bruising. I usually tell patients, you plan on having potentially up to a couple of weeks of bruising. It may be limited to the upper eyelids. It may actually extend around the orbit, even into the lower eyelids. But in this particular case, we saw not a lot of oozing or hemorrhage during the case. We're expecting, hopefully, to have minimal bruising that would certainly be able to be covered up with makeup. For many, many women, makeup can hide bruising within several days after this type of procedure. There's certainly some swelling to be expected as well. Again, everybody's going to swell differently. And what we do is we just plan to say, hey, there's going to be swelling. However, the worst swelling is usually going to be within about the first 48 hours. And then that swelling should diminish relatively rapidly after that. Welcome back. The first thing I've got to say is, how many plastic surgeons does it take to do a blepharoplasty on Chuck Norris?
I don't know how many.
I don't know, but I like the look on your face when you're saying, I have no idea. Hey, we're here with Tracy. We're talking about upper lid blepharoplasty. Tracy actually had an upper lid blepharoplasty a few months ago.
I'm wondering, because a lot of patients have similar stories, had you been considering this for a while? Was there an event that happened that made you consider it more strongly? I'm just sort of curious your personal story.
Well, I think, like I mentioned before, I looked tired, but I had quit wearing eye makeup because it was ending up on the top of my eyelids.
You hear that all the time?
So at that point, and a few comments, people were making comments about really how tired I was looking, and when I started looking in the mirror, I thought I need to do something.
Sure.
You weren't really feeling tired. You just felt like you were looking tired.
I just looked tired.
Right.
I looked tired.
So you decided, I want to do something about this.
Yes.
And then we said, okay, let's talk about what the options are.
Right.
And we talked about doing this upper lid blepharoplasty. We talked about taking out the skin and the extra stuff that's on the upper. And what did you think about that?
Well, I think when you first hear it and you're looking at the surgery, it's a little bit scary, but as you get into it, it's really quite a simple procedure. It's a very quick procedure. It was painless, and I love the results.
Say that again.
It was painless.
Painless. I'm pretty sure when Dr. Wrye does it, it's not painless.
It may not be. It may not be, but you did the surgery and it was painless.
Well, I'm going to say it wasn't necessarily painless. You have to have some degree of numbing medicine. I mean, you had some recovery time.
I did.
How long did it take before you felt like you were ready to go back to work?
I went back the very next day. But I will tell you, I was bruised. I tend to bruise easily, so I was bruised for a couple of weeks.
Tell me about other things about your recovery. Were you tired? Were you able to focus and concentrate?
I wasn't tired at all. I think right after the surgery, I believe I used ibuprofen maybe one day. There was no really downtime for me. Sure. I went right back to work. I didn't look so great while I was healing from the bruising, but very, very easy procedure to go through. I'm thrilled with the results. I would do it again. I would have done it sooner if I had known how easy it was.
Sure.
So I don't think I would have waited as long as I did.
Would you say that that's something that if you were going to have another procedure or a blepharoplasty, which was the easiest thing that you could ever think of having?
I thought this was pretty simple. Mm-hmm. I think with women, we're always looking at some form of facial rejuvenation as we age. So I know there's laser treatments out there, and there's Botox, and there's all of these other possibilities that you can look at. This was really quite simple. Just a little bit of just downtime with the bruising, but it didn't keep me from my activities.
Sure. Well, Tracy, thank you very much for coming on and sharing your story
Thank you.
with us. I think it's going to be really helpful for the audience to see someone after the fact, now that we've seen Jen and her surgery. Unfortunately, it was a little too close to the surgery time to show her 3-month result like we have with you. So thank you for coming on.
Absolutely.
Very
Thank
good.
you.
Think you look great.
Thank you.
All right, so all these people behind the cameras, they tell us we got to wrap it up.
Is that like something we eat? A wrap?
No, that's we end the show.
Oh.
Dummy.
So we wanted to thank Dr. Adlington for coming in, giving us a little bit of education about how one looks at upper lid blepharoplasty, visual fields that might
Sure.
be a candidate for
That was
that.
very educational. I appreciate
That's
that.
something, we don't actually do. We don't know about so much. We rely on experts like Dr. Adlington who know, hey, this is how we check a patient to see if they might need this for medical reasons. But we also want to thank Tracy for coming in and sharing her story with us, and Jen for doing surgery.
I think she's got a wonderful result. She's going to be thrilled. It was a lot of fun.
Hey, glad you were here.
I'm glad you were here.
Thank you very much for coming.
See you guys later.